Hello everybody, welcome to the next episode. Today I'm going to be going over prosthetics and what they're used for primarily, what the benefit is and the different types, because there are different types. There's actually a lot of different types. There's some that are still used and then a lot that are not used anymore, only mostly because of technology and just better things than what they were before. So without further ado, as always, I'm not a dentist. I am not a doctor of any kind. What I do have is just I have over 10 years of experience in the dental industry, just dealing with patients and treatment plans and helping them better understand what it is that they're getting done, what their options are, and why the doctor diagnosed what it was that he diagnosed, how it started potentially, and what they can do to make their life better for a longer period of time, as well as improve their health, overall health, not only physically but orally. So again, today I'm going to be going over prosthetics. So what are prosthetics? There's different types of prosthetics. You have your crowns, you have bridges, which are essentially single crowns that are attached together. You have partials, you have dentures, you also have crowns that go on implants, you have laminated veneers, pretty much. These are all things that are a prosthetic, and a prosthetic is just a fake thing that is attached to your, in this case, to your mouth. Because you also have different types of prosthetics, which are, for arms, legs, so on and so forth. It's just something that is not originally part of the body, that was attached to take the place, or in this case, help a part of the body. In your mouth, it would be to keep the function of something that was there, in addition to protect the other teeth that are around it. Now, what is the main principle of a prosthetic in the mouth? And when I mean the main principle, I'm referring specifically to the ones that are not for cosmetic reasons. So, for example, veneer, outside of just making you look better, because you either don't have a cracked tooth or it's not stained, so on and so forth, there really is no other medical benefit to it. But you have, for example, the crowns, partials, or even dentures. They do have more of a benefit medically and for yourself as well, outside of the aesthetics. So I'm going to start off with crowns. And crowns, normally you use them after you get a root canal. If you have a tooth that, for example, is really well damaged, it could be from either a really big crack, it just need to reach the nerve, where you don't need a root canal, or you just had a really big cavity, again, that's engulfed the tooth, and the tooth is decayed for the most part, and the filling is not strong enough. They'll put a crown, and what crowns are primarily good for, it's two things. One of them is that they protect the tooth that you still have underneath. Most people think that what a tooth is the crown, which is the white stuff that you have on your top, which is your enamel. And your tooth is actually a lot more than that. You actually have your root, which I've gone over in prior episodes, which is the other part of the tooth. And that portion of the tooth, which is engraved inside underneath your gums and inside your jawbone, is bigger and longer than your actual tooth. And that's primarily what keeps your tooth in place, and it's what supports and takes all the beatings that help your tooth stay in place and prevents you from losing them. Now, a crown takes the place of the tooth in which it's being placed. It is not the same as your tooth. In other words, if somebody puts a crown on your tooth, it does not mean that you can go and chew on ice, chew on bone, try and crack a walnut with your teeth, open up a beer bottle. They're not designed for that. They're not, and because they're not that durable compared to your natural tooth. Not that they're not durable, because you can still use them for many mundane things that you normally use them for, like eating, which is primarily, hopefully, the only thing that you're using them for. So you want to make sure that you take care of them when you do get them. The other benefit that they have also is, because they are taking the place of your tooth, your teeth actually have another function outside of eating, and that is they also help maintain each tooth in their adequate place. So what happens is that whenever you get a tooth extracted outside of your wisdom teeth, the tooth that are next to them, the ones that are on the side and also the ones that are above it or below it, whichever tooth gets extracted, start to move. And when that happens, you start getting into other problems, where the teeth next to it might start shifting. The gums do not adjust themselves to your teeth. So what happens is you'll start getting cavities. Those teeth will be falling out of place. You'll have bone loss. You might get periodontal disease in those areas, and then you'll successfully start losing the rest of your teeth. And it's not something that happens to some people. It happens to everybody. It's just a natural way of how the mouth acts when you start extracting teeth outside of your wisdom teeth. And when that happens, your teeth start moving and shifting into not adequate directions. Your gums do not adjust themselves to your teeth. They start crowding the areas, and then you start getting into other problems, like you start having cavities because those areas that where your teeth are shifting into, you cannot clean easily. You could potentially get periodontal disease for the same reason, and eventually, and you're going to start having bone loss, and eventually you start losing those teeth, and successively you just start losing all your teeth. It has nothing to do where it can happen to some of you and not all of you. It happens to everybody, and the only reason why is because that's just how your teeth are. It has nothing to do with science. It has nothing to do with anything. It's just the natural progression of how teeth move. So having all your teeth in your mouth, with the exception to your wisdom teeth, which again are the only teeth that you can extract, is super important. And now crowns help prevent the shifting of teeth. Not so much next to each other, but on the from an opposition, because when you bite down, there's a specific pressure that you put in your mouth. Everybody's is unique to themselves, and that pressure that you put in when you close your mouth is what prevents your teeth from coming down or climbing up. So crown helps prevent that in that situation. Another thing too is that on from sides, well, not so much, because it kind of relies more on the root than it does the actual crown, but not all teeth are positioned perfectly. So if you have a teeth that's shifted in the wrong position, if you have if maybe there might be a little bit more spacing than they normally do, if you have a tooth that's just bigger than a regular tooth is, or smaller than a regular tooth is, everybody's teeth are different. Nobody's is really the same. And then the tooth breaks and stuff. The tooth next to it could potentially shift over and close the gap, misaligning the other teeth. So you want to put a crown in those situations to prevent them from happening. Again, the crown is primarily when you have the root of the tooth is still within your mouth and they can still place a crown. Partials. Partial in essence is a denture, but only in areas where you are missing teeth. So for somebody who's looking to save money and they say they've gotten a lot of teeth extractions and they're later going to get a partial, it would be the cheaper of, I would say, the three, which are a partial, a bridge, or implants. And what it does is that it prevents the other teeth from shifting around, and that's a really good thing because it increases the longevity of your teeth. Again, because they're not moving around. But the one thing which some people get used to it, some people don't, and then some people just get tired of it, is that you do have to remove it. You do have to clean it because it does get dirty. It fills up with plaque, and you have to clean it every night. If you don't, then it causes issues with your other teeth. So you have to make sure that you clean your partials. The other prosthetic after that, which I already mentioned, is the denture. The denture is it's pretty much just fake teeth, but it's all your mouth. And that's primarily when you either have to have all your teeth removed or when you're a person that's already lost all your teeth. And then you obviously need a denture because you need to eat. It is extremely important. So that's a denture. Now going back to the bridge, as I mentioned, and the implant. The bridge, in essence, is just it's crowns that are all just put together and then attached in your from one tooth to another. So it's just like a regular bridge from where cars pass by. You have two crowns, the two legs, and then you have the one crown in the middle that's attached to the two other crowns, and your natural teeth are where the crowns sit on top, and then there's a one tooth in the middle, the one crown in the middle, that is attached to those two crowns, and you have just one long, what's called a bridge. That does the exact same thing as a partial does. It is more expensive. It is permanent. You don't have to remove it, and you again prevent the issue of having your other teeth move around. Now, the only negative to a bridge Not that I'm not against it. I just feel that for the majority of people, if you're a person that doesn't take care of your oral health, versed in the oral hygiene department, I wouldn't recommend that person getting a bridge. The reason why is because the bridge, when you're putting a bridge, you're not, they have to shave down the two teeth that are next to them. Um, and in essence, if a person that's in that situation, let's say they have the bad habit, they have a really bad habit of chewing ice. They get a bridge and they start chewing ice, the bridge breaks, it was expensive and they can't afford it. You're not losing one tooth. You're not replacing one tooth now. Now you have to replace three teeth because now you have two teeth that you can't use because they're in a weakened state because they were um, built for you to put a bridge on. Um, or let's say you're a person that you don't clean every day and stuff, and then you start getting cavities in those teeth, and then one tooth starts hurting you, and then you have to get a root canal. The bridge has to be taken off. If underneath you got a cavity, then the cavity has to be taken care of. The bridge might have to be removed to be cleaned underneath. In those situations, you're not when they're removing a bridge is not just removing one of the crowns. You have to remove the entire bridge, and it's three teeth that you're concerned about. There's a two where the bridge goes, and then there's one that you're already missing in the middle. Um, so and if a bridge breaks, then you have to get a new bridge, and it's not just one tooth that you're worried about. You're worried about multiple. It's an entire section. So that's the primary reason for. Again, it's in a case by case basis. But if you're a person and you're honest with yourself and and you're like, I don't brush my teeth every day. I really don't. I really don't. I'm really not on top of my oral hygiene. Then you should probably focus on getting a partial more or even getting an implant. Um, and the reason why, which I'm going to go into implants, although I have talked about implants in prior episodes, but in this case I'm only going to go over the crowns. When it comes to the bridge, again, going back to the bridge, it's something that you want to take into consideration, especially when you talk to your dentist. You have to be honest with yourself because, again, you don't want to fall into the situation where you were trying to save one area and prevent your teeth from moving, and then you end up now you're losing you're short three teeth as opposed to just one. Um, so with the implant in a sense also does the exact same thing. It prevents all your teeth from shifting, and the crown. The only thing is that the crown is a little bit different because there's different types of crown when it comes to the implant. Um, and it's mostly dependent on the type of implant. Every implant is different. It's not really important for the patient, to say the truth, because it's just something that's related to the doctor. But there are different types of implants, and one form of something for you to know is that if you do get an implant in one location, or even in or let's say you're from out of the country and you got an implant in your country because it might be cheaper, whatever your reasons are, and then you leave and you come back to the States or you go to your country and stuff, the new dentist where you're going to see needs to know what type of implant you have. And there's no way of them knowing what type of implant you have by looking at the implant. You have to normally, either when you get an implant, make sure to ask your dentist where you got the implant, or your specialist where you got your implant done, what is the type of implant that you got placed in you. So that way if you by any chance have to go to a new place, be it you moved or whatever your reasons, you have the information for the implant. So when you go to the new dentist or the new specialist, and you tell them which implant you have, so that way they know what abutment to get and what crown, and for the crown placement. Okay, to your mouth, that it's not part of your natural teeth, or just your natural, that's natural in your mouth, is considered a prosthetic. So that's pretty much it for today. Next, I'm going to be over at TMJ, which is very important for a lot of people. There are a lot of people that have TMJ and they don't even know that they do, and they think that it might be something else. So, as always, flourish and prosper.